This is a patient with grade 2 L5/S1 spondylolisthesis who's actually coming all the way from Virginia to get the surgery done with us in Minnesota. And here I'm marking the trajectory of the L5/S1, and then I put first a spinal needle, then a gem sheet, draw some bone marrow from the right L5, and you see that I'm now approaching the disc of the L5/S1, which is extremely collapsed. You will see more in the lateral view. It's really hard in this patient to get the proper approach to the L5/S1 because of the grade 2 spondylolisthesis. And as you see, I'm spending quite significant time. Our average time for one level is about 35 minutes. This surgery was almost 55 minutes. So here I'm approaching the disc back and forth to reach the disc base. And after many passes, I'm able to find the proper approach, which is quite medial. Usually with the listhesis, you go a little lateral, but here I'm using a technique that I use with the directional K-wire to get into the disc. As you see, first I am putting the K-wire on the top of the disc, then directionally go medial, enter the disc, then I change the direction to enter that. In the lateral view, that's better visible. Now, but once I'm in, I dilate. Neuromonitoring is done at all time. As a matter of fact, I did a neuromonitoring of this construct after it was in up to 13. So we are quite safe. Now I'm entering the disc, dilate the disc, and perform my discectomy. And as you see, I'm all the way to the other side actually. First we drill the disc, then after the drilling of the disc is done, we have created a space that then we pass a series of tools for discectomy and preparing the end plate, pack the space with tricalcium phosphate, and then I put the cage in. As you see, even though I'm approaching from the left, I'm able to put the cage all the way to the right side. And now at this point, I'm just putting screws in L4 and L5. You will see in the lateral view that this case is quite significant with listhesis. So that makes obviously the entire procedure more complex. Now here you see the screws are in, then I put all the screws in, including the and left S1. When I was stimulating, I get actually a signal at 10 milliamp on the left S1, so I replaced that screw actually. Here you see I bring it in and put a new screw in, and this is the final construct. And I just checked on the patient, has no nerve irritation, waking up, it's pretty comfortable. Thank you.